So what was the evolution of surgical guides? Well, we used to have to take a impression with the impression material, which most patients didn't love. Then we'd have to pour a stone cast model. And from there, we would have to look at where the placement would fit in with your tooth position. The problem with those were there was no way to overlay the actual bone levels and where that implant would be going. So as technology improved and we were able to incorporate CT scans into our practice, we're able to incorporate intraoral scanning, we can now overlay those two, and now we have a full picture of where the tooth needs to go, where the implant needs to go, and where your anatomy as far as bone is concerned needs to go. It also allows us to see vital structures like your sinus cavity or nerves that we want to avoid with the placement. So what are some of the fundamentals of 3D printing? Well, 3D printing is an additive manufacturing process, and we've gotten to a point where now we can do this in-house in the dental clinic. What we mean by additive is instead of taking a stone cast model, removing a section of it and trying to fit the tooth and the implant position into that, we can now slowly through the process, through a combination of the computer talking to the 3D printer, add the material and build up to just have the smallest footprint of a guide, which allows us to place the implant comfortably and within the confines of the oral cavity. This was a major step forward because before we used to have to take a lot of other materials in order to fabricate the guide, and they would be bulky and difficult to use within the mouth. What are the different types of 3D printing? Well, the main two types that are used in dental applications are stereolithography or digital light processing. They typically go by acronyms such as SLA or DLP. There's other types of 3D printing manufacturing, but those two that we just talked about involve the use of light and the fabrication of layers that help to build up the process. What this does is it allows us to create the guides in the smallest confines of what would fit in terms of your mouth, what fits around your teeth, and what allows us to safely place the implants without much movement in both lateral directions or in a apical direction, which is what would be up and down. This is what keeps it safe in terms of avoiding anatomy, which helps us to fit the implant into the confines of the bone, and also helps us to angle the implants so that they're going to fit for your bite and how the crown is going to fit. The best benefit of these two types of manufacturing is that we can also combine different materials depending on what the use is, and also the variations that come in different people's mouths and how their bite patterns are.